All right. Good afternoon, everyone. On behalf of the Tulsa United Way, thank you all for joining us. I'm Brent Sadler, Vice President of Community Investments with the Tulsa Area United Way. A few weeks back, Mara Gooden, who you'll hear from in a few minutes, sent me a note, and she was relaying a concern around the abuse and neglect that was going to take account in our community due to the stay-at-home orders. And very soon after that, Gail Lapidus received a very, very similar note. We got about a half dozen different organizations together pretty quickly to discuss and talk about this particular issue. And we can be talking about domestic violence today as if we were talking about child abuse in our community. But we got this group together today to bring this awareness together. Childhood should be filled with joy, hope, unconditional love, and acceptance. Tragically, however, far too many of our nation's young people spend this foundational time of their lives in fear, pain, and uncertainty enduring abuse and neglect that threatens their health and well-being. These are the opening two lines of our proclamation declared by the Office of the President on March 31st of this year. This proclamation marks April as a National Child Abuse Prevention Month beginning in 2020. And although we are towards the end of April, we all know that child abuse prevention and awareness is an everyday issue. As we've all experienced in this difficult time, this has been hard. With the call for physical distancing and virtual learning situations, children were isolated in their homes. Many in our community, like teachers and daycare providers, are not interacting with our children to detect when something isn't right. So we're glad that you're here with us today to hear from a group of experts that will help us understand what's happening in our community as they bring awareness to this issue. We'll hear from three agencies that we work with year-round: Family and Children's Services, Parent Child Center, and Child Abuse Network. These are three of our 59 partner agencies that you support as donors and collaborators through the Tulsa United Way. And we're proud to work with them on this very important initiative. As many of you know, Tulsa United Way is the convener. Our mission is to unite people and resources to improve lives and strengthen our communities. Your panel of experts for this webinar are Mara Gooden, President and CEO of Child Abuse Network. She will provide a perspective of what they're seeing since social distancing began in mid-March and why risk factors have gone up. We'll also hear from Kim Parker, Vice President of Clinical Services with the Parent Child Center. She will speak to the warning signs we should be looking for and how they're tackling the challenges of serving clients during this time. And we'll also hear from Christine Marsh, Senior Director of Child Abuse and Trauma Services with Family and Children's Services. Christine will discuss the ways our community can help each other, as it takes all of us watching out for our children to make sure that we get the help, that they get the help that they need in order to stay safe. So I'll turn it back over to Krista Hemme. She's the Vice President of Marketing at the Tulsa United Way, and she will moderate today's webinar. Krista.
Thank you, Brent. This is an opportunity not only to hear from our experts, but also to have your questions answered. So as I said earlier, we have well over 100 people joining us on this webinar. So we will take your questions in written form. If you'll go to your Zoom toolbar, you'll see a Q&A button. You may submit your questions via that Q&A tool on the Zoom toolbar. And you can type in your questions anytime during the webinar, and we will answer questions at the end of the presentation. At this time, I will now turn it over to Mara Gooden, who's the President and CEO of the Child Abuse Network. Mara?
Good morning. Thank you, Brent, for that intro, and Krista. We're so glad, so appreciative of the United Way for convening this collaboration so promptly. That's what you guys do best, and we appreciate that. So I've got a few slides here that I'm going to go through. The first one is an overview of the Child Abuse Network. So many of you probably know about CAN, but we were one of the first children's advocacy centers established in the U.S. This Children's Advocacy Center, we call them CACs, The CAC model brings all the professionals in a child abuse investigation together under one roof. So we're all housed in a very safe and secure and child-friendly facility. The model really helps reduce trauma for the child. It eliminates the need for kids and families to have to travel all around town to several different locations, so hospitals, police stations, etc. And because all the professionals are together, the child only has to tell their story one time to a specially trained forensic interviewer, which they can do that in a therapeutically and forensically sound manner instead of in sort of an interrogation style. Our setup also allows for a better flow of communication among professionals and a more efficient handling of these cases, which are really critical and confidential cases. The center also oversees the Tulsa County Multidisciplinary Team, which meets each week to review the more complicated cases, and that can include all child deaths and near deaths. So that's a really important meeting that, of course, we've all been doing over Zoom these last several weeks. All right, so on our next slide, we'll talk a little bit about the jeopardies that we're seeing to children's safety. So the big threats to safety that we're seeing right now, it's really a catch-22. By protecting kids from the pandemic, we're inadvertently exposing them to an epidemic, which is our child abuse epidemic. We've exposed them to additional potential harm. We're seeing some of the most serious cases of neglect in our center's history right now, and these aren't kind of dirty homes or kids who need a little bit more supervision. The neglect that we're seeing is really resulting in life-threatening harm to kids. So prolonged absence of any supervision, which might allow a child to get into some potential bad situations. You think of a child maybe wandering into a pool or being exposed to maybe animals that are harmful. A lot of kids in our community rely, of course, on school-provided meals and other items. When you think of these pantries or closets at school that might provide them with clothing and food even over the weekends, backpack programs. So they're not having access to that. And while I know my children's school has a program where you can go pick up meals, for some kids that might even be a barrier. They may not have transportation or the ability to get to the school to get a meal. So these kids now have gone for over 6 weeks being away from those items. We've likely all experienced the stressors of working from home. At any given moment, one of 4 children could go running through my background here screaming about a video game. So that could be stressful, and this is overwhelming, but we know that the stress factors that some of our families are experiencing are really risk factors for abuse. Another thing we're seeing on a regular basis, about half of the cases that we see at CAN are for sexual abuse. We know the dangers of the internet and how that could be used as a tool. We also know that isolation is a tool perpetrators use to groom kids for sexual abuse, getting kids away from people that they trust, that they could report to. Scarily, the internet right now is something that we've driven nearly every child in the state to use for school. So if we're not watching carefully, there can be temptations to wander into places they shouldn't, and that provides access for people who might seek to harm a child. And then finally, a jeopardy that's not on the list here, but exposure to domestic violence is considered child abuse in Oklahoma, and we are seeing a big uptick in the number of domestic violence cases in our community. And then our next slide, what we're seeing since social distancing. Number one, a massive reduction in child abuse hotline reports. This is reported by Deb Shropshire at DHS. About 50% of cases statewide, there's been a reduction in the number of reports by about 50% statewide. So the cases that are coming through are the really quite severe cases. I know the DHS unit that's embedded at our center handles the highest priority cases, so the really severe, shocking, and heinous abuse. And they may typically get about 10 referrals in a week. The past 2 days, they've received 16. So while things slowed down for us at the center the first couple weeks and it was quiet, which is very scary, the number of high priority cases that are coming through now is perhaps even scarier. We're seeing some random things that we hadn't seen before. So kids running away or entire sibling groups running away, trying to seek help independently, going to neighbors or other places like that. A higher number of referrals that are coming from medical centers or emergency rooms where the abuse has been so significant that it's required a visit to the ER or hospitalization. And lastly, something that we're seeing that doesn't so much have to do with the child themselves, but we're seeing an increase in trauma to the team and the professionals that are working with these kids. Life is just harder right now for all of us. The cases that we're seeing are harder, and all of us in this field recognize that as we emerge from the social distancing, more kids are going to come forward, and really all of us will be inundated with cases. And that's all.
Mara, thank you for your insight. As a parent of 2 young girls, it's heartbreaking to hear what you shared and what's happening in the community while this isolation is happening. So I'm glad to see the number of people that are on this call today who can learn more about ways to identify and help report the abuse. It's going to take all of us working in the community to do this and protect our children. The next speaker that we have is Kimberly Parker. She is the Vice President of Clinical Services with the Parent Child Center. And at this time, I'm going to turn it over to Kimberly.
Hi, good morning, everybody, and thank you for being here. Can everybody hear me okay? I guess. If we can go ahead and move to the next slide. And the next one, a quick overview of the Parent Child Center. Our mission is to prevent child abuse and neglect through education, treatment, and advocacy. And we're a hope-centered organization. We really believe that once parents know better, they can do better. We collaborate really closely with Dr. Chan Hellman from OU on the science of hope, and use that as the primary focus of our outcomes. Just the next slide. Just a quick overview of some of the services that Parent Child Center can provide. We provide 3 levels of prevention efforts: community outreach, which kind of highlight our Kids on the Block and Anti-Bullying Coalition. There's some great videos available on our Parent Child Center YouTube subscription page that Steve Hahn has put together that highlights intervention strategies for child abuse and prevention, things teachers can do, how to recognize signs and symptoms. So I encourage you to check that out. Then the middle section, our services family support, is we offer free voluntary family support services in a home-based capacity for caregivers and their children from ages 0 up to kindergarten or age 5. And then the third block in the house is our therapy services. We offer trauma-informed, evidence-based treatment models to really help families heal from trauma, as well as learn better parenting strategies to prevent child abuse and neglect. We can go on to the next one. And the next one. So I'm gonna talk just a little bit about the signs and symptoms of child abuse and neglect to look out for during this time of physical distancing during COVID. The 5 R's are just a good, helpful way to remember. The importance of just raising the issue of no matter what, if you're in a business, if you're a grocery store, whether you're a school, a church, you can bring up those issues and get information out to caregivers on parenting tips, resources, hotlines. And then 2, the importance of just reaching out to those family members, your neighbors, people with newborn babies, families that you know may have a history of domestic violence or other trauma concerns, reaching out and just checking in on them. Physical distancing doesn't mean social distancing. I'll go into a little more detail on 3, remembering our risk factors. The number 1 sign to pay attention to for child abuse and neglect is if a child or a teenager discloses that something has happened to them, to you. So it's important, regardless of your perception of what the child is disclosing at that moment, to pause and express belief in the child and really listen to what they're sharing. Other than that, there's no one particular sign or symptom necessarily. It's important to look for a pattern of behaviors, a pattern of the different signs and symptoms. And I'll go over some brief ones, but you can get a lot more information and more detail at the National Child Traumatic Stress Network website. Also childwelfare.org has a lot of great, more detailed information. But one thing right now, there's so much virtual learning going on, really paying attention to the child's environment when you're on those virtual, either Zoom calls or even on the phone, listening to the environment, what sounds are going on, the tone of the voice of the child, of the caregiver, or sounds in the background, observing the body language if you're able to be on telehealth. While some of those may not rise to the level of actually making a child abuse report, it highlights there may be a concern, and encouraging you to reach out and check in on the family, see if they need any additional supports, provide them with resource information, hotlines. I think also really paying attention to bruises or injuries that you may notice or the child talks about. Really paying attention if the injuries don't seem to make sense with the explanation that the child or the caregiver provides, or if those injuries don't really make sense based on the child's age or developmental level. Those are really concerning. Also looking out for changes in behavior, whether that it may be falling asleep during the virtual learning time or during your session, and that's not typical behavior for that child. It could be, in the classroom, not turning in their work. Again, that's something to look out for. That doesn't mean that's necessarily you need to immediately call the hotline. Paying attention to sexual knowledge or sexual acting out behavior that is not age or developmentally appropriate for the child. If a child's running away, if there's increased substance abuse, sexual acting out, promiscuity, those are things, again, to be aware of and ask questions about. As far as caregivers, I think it's important to really pay attention if there's a caregiver you're noticing an increased use of alcohol or drugs, whether that's prescription or over-the-counter medication or illegal drugs, really paying attention to that because that can impact the safety of the child or the infant in the home. If the caregiver appears apathetic to a child's educational needs, their health, their safety, their supervision, that's definitely a concern you want to pay attention to. I think we can move on to the next slide. Some things that therapists are doing to help prevent child abuse right now are really trying to ensure confidentiality and privacy during conversations with the child or a caregiver, both obviously on our end, but also trying to make sure the child or the caregiver has a safe space to discuss and talk about things that may be going on. One thing that teachers can do with the virtual learning is opening up a chat room or some kind of a safe space, an email, a phone number on how a child could reach out to that teacher or a faith leader or a coach to share concerns that may be going on. Let's see, I think we can move on to the next page. I think it's really impressive how so many of the Tulsa Area United Way agencies, Family and Children's Services, Parent Child Center, CAN, DIVIS, everybody's moved really, really quickly to minimize the impact of losing in-office services are to clients. We've moved very quickly to minimize that. And I think all three of the agencies, I know Family and Children's and Parent-Child Center, were using telehealth services to keep face-to-face sessions going with clients and families. Telephone services, many of our clients don't have access to data or Wi-Fi, so that having that telephone service has been really helpful. And we're able to keep doing intakes, even to bring in new clients. Continuing our parenting group classes. At Parent-Child Center, we're doing pre-recorded sessions of our parenting groups and sending them out via secure links to clients, and then following up with them via Zoom or telephone, as well as some live Zoom parenting classes. And I know Family and Children's Services is continuing through online videos of their family life education classes. Another thing that agencies have done, both Parent-Child Center and Family and Children's, have sent out different kinds of parent-child activity packs. We called ours Totes for Hope, and just have some basic need items for families, really focusing on those parent-child activities that they can do together. Also including, helpful resources, parenting tips, the hotline information for, parenting hotlines, suicide intervention hotlines, the COPES crisis hotline. So parents know that there's, it's my timer, sorry, to make sure I didn't go over. To make sure they've got resources. And then also, I think we've all had an increased just social media presence, trying to get out information on prevention and education, and really letting caregivers know that this is a really crazy time for all of us, and that all of the emotions that they're feeling are normal, and they're okay, and there is help available. And that right now, parenting is really hard. We can move on, I think, that's just our contact information. And again, thank you all for being here today and taking time out of your schedule to listen and be here and educate yourself on some other strategies. And I think one of the main things to take away is right now there's something that all of us can do in the community to help prevent child abuse from escalating in our community. So thank you all.
Thank you, Kim. I would wholeheartedly agree with you that parenting is really hard right now. It was hard to begin before the pandemic, but right now with all of these additional stressors, the isolation, parents, some of them being out of jobs, food insecurities, it is a very, very stressful and hard time right now. So thank you for sharing some of the warning signs that we should be looking out for. I know that you covered a lot. We're going to make this PowerPoint presentation available on our website as well, along with the video. We'll be emailing out some of these resources to those of you who registered for this webinar as well. Right now, I'm going to turn it over next to our last panelist, who is Christine Marsh. She is the Senior Director of Child Abuse and Trauma Services with Family and Children's Services. Christine?
Thank you, Krista. And I appreciate all the words that have been shared by Mara and Kim before me. I want to go ahead and share a little bit about Family and Children's Services and give our brief overview. We've been at it for just about 100 years come next year, and have always had a place in our services for early childhood services, child abuse and trauma, whether it's prevention or intervention, and really looking at the parenting classes, because we know that kids and families exist together. And if our parents aren't doing well, then our kids could be suffering as well. So just a way to really try to look at our services and make sure that we are offering services in locations where kids are needing extra support, like school-based therapy, over in our Head Start and early childhood programs. Also our adult psychology and child's adult psychology. We've got psychiatric services for children and adults. We provide adult mental health services. Our agency does have a pharmacy for those families who receive medication prescribed by our doctors, so that we can be a little bit more of a one-stop shop for our families when they're receiving services through us. We also are able to look at how we're providing services for our indigent, low-income, underinsured, and uninsured families. So we know that oftentimes families have to make very difficult decisions about even reaching out for services because they have to consider how much are these going to cost. And we know that copays and deductibles and whatnot can be a barrier for families receiving services. So that's one of the main reasons why United Way is so critical for our community, all of the agencies speaking, is so that we can provide services to people and not have to turn them away for inability to pay, because we recognize that for our community to be strong, we all need to be strong. So I appreciate you being able to hear a little bit about what we do. So let's go to this next slide. Let's talk about how to report suspected child abuse. And oftentimes this seems like a very scary thing, something that somebody else is supposed to be doing. 1/3 of the reports to DHS are from our educational field, from our teachers, from our daycares. And it's just something else that we shouldn't ever really have to be worried about. Now, we can think that, but in Oklahoma, we are all mandated reporters, and that's a good thing. It gives us that permission to go ahead and report on those things that we might see as being not so good, or maybe we're curious or wondering about the impact that it has on a child or a family. So we really want to encourage everyone to report, and not to do so in a way that you feel like is going to be punitive or reprimanding a family by any means, but as a way for these families to have hope, to have services, and to receive new ideas and new suggestions and wonderful interventions like the services that Kim and Mara have already shared about how we can really detect these children and families who might not know how to ask for help themselves. And in a lot of ways, they don't necessarily know how to stop some of the things they're doing without having people intervene and suggest new techniques and ideas for them. So if we suspect that a child or a vulnerable adult could be the victim of abuse or neglect or exploitation, we want to call that statewide abuse hotline. And you've seen that on several of our slides, and then some of the other information that's been shared. Now, when you do report, you certainly don't have to have your own investigation already done. You don't have to have the evidence. You don't have to have a lot of reasons why you think that something could be going wrong. Some of the symptoms that Kim spoke about earlier could be something that you see one time and you might find the need to report. The beautiful thing about reporting in the state of Oklahoma, as well as other child receiving reporting services across the nation, is that they keep a data bank of those reports that have been made. So if somebody is reported on several times for a similar or a lot of variant reasons, then DHS is able to look at those and see, while maybe not one single report is indicative of needing to do an investigation, maybe it's a compilation of all of these reports that might make them realize something could be going on in that family, and we need to go ahead and take a peek, and if nothing else, offer services to this family so that maybe there won't be additional reports in the future. So we want to look at reporting as being a very positive element to helping families in our community. Again, we don't often have a mirror looking at us at when we need to make improvement. We might not often see when we need more sleep, when we need to lose weight, when we need to make those changes for ourselves. Sometimes it takes somebody else giving us that nudge, and it might be the state of Oklahoma that needs to do that. So callers can remain anonymous. That's the other wonderful piece of our child abuse hotline, is that you don't have to say who you are. It's nice if you tell them who you are, just in case they need to call back and get additional information from you. But if you're not comfortable doing that, you don't have to. You can be anonymous. Again, all calls are documented and a disposition is assigned. So that can create a trail of reporting on that particular child or family that's being reported, so that your call might not be the one that caused the investigation to happen, but it can be something that really added to a great deal of information that DHS needed. Reporting is helping a family make needed changes and obtain services. And it obviously makes a difference. All those families that are being seen and can, and those families that we're worried about that we haven't been able to see because reports aren't being made yet, are patterns that might have been established, and various reporters can substantiate those, and it can make a difference for a family. Those children who are running away trying to get help, and those parents who don't know where else to turn, it could be your reporting voice that makes a difference for them. So let's look at our next slide and see how we can think about what we can do ourselves if we start feeling overwhelmed, or if people that we know and love and care about, or our neighbors or whomever, seem to be overwhelmed too. What do we do when we need help? How can we get parents and caregivers and folks to think about this very difficult, stressful time? So the first thing that we need to remember is, at this point in time, many of us are working from home. Our families that might need help from us could also be working from home too. If you're on lots of these Zoom calls throughout the day, or other kind of webinar kinds of things that you need to do for work, you've probably already recognized it takes a very different toll on your brain. It takes a very different toll on your physical stature. We're sitting a lot more than we used to, etc. So when we look at these families, those that we love, those that we care about, our neighbors and strangers, we want to recognize that in all of them too. We want to remind these folks to get fresh air, to take a walk, do some of those things that can help us calm down, that maybe we've forgotten about since things have been different. We haven't had some of our same outlets with our communities needing to shelter in place that we had previously. So we might have to have developed new ways of relieving stress, or getting outside, or finding new things that calm us down. Petting an animal, just stepping aside and washing our face, listening to music, picking up a book and giving us permission to read for 5 or 10 minutes when something is really stressing us out or being overwhelmed is helpful. For our parents who might otherwise have, their schooling given to somebody else to do, now they're in charge of schooling their children as well as maintaining their job, or they've been laid off and they're fearful about how to find a job now. They're trying to collect unemployment. Lots of things are happening. These parents are sometimes at their wits' ends, and they may find themselves thinking and doing things that they wouldn't normally do. So we want to be careful and thoughtful as friends and family to also really listen and talk to another person. Just talking to another person, hearing a human voice, can break that tension moment and that overwhelming point. So that's great for our family and friends, but what about that stranger we see at the grocery store? Oftentimes, it's okay for us to say hi. It's okay for us to say, how are you? Sometimes just that smile, or remarking to them on how they are or aren't doing okay with their child, or wow, that must be tough, or looks like a long day, is enough to break some of that tension and normalize things for that parent again, so that they don't feel like they're this terrible person having trouble with their child in the grocery store, at Quick Trip, wherever. So again, that human contact can be huge for people who just feel like they're alone right now, even more so with this isolation taking place. So we know that also we could use more rest. When our brains and our bodies aren't well rested, that can get in the way as for us to be able to think clearly, and to really have much more ability to think calm and use our frontal lobe more than our emotional kind of reactivity. So we want to really encourage people to take naps during the day if they need to. If their kids are out doing things that are more physical outside, maybe the parent can take a little nap in a chair outside while they're out there. Just different ways that we can kind of manage this time now together. We want to also think about Dr. Folletti and his comments after the adverse childhood experiences study that he did. And he goes through lots of information about child abuse, trauma, and lots of things that happen in childhood can potentially cause bad things to happen as you grow older if they're not addressed. So we have the services that we've talked about today being here to help those things be addressed, but preventing those can also happen, and that is by reporting, by offering parenting classes that have been talked about by Kim, as well as Family and Children's Services, And more than anything, allowing people to ask for help. And sometimes telling them, maybe I can ask for help for you. So we want parents to learn how to be able to control their emotions. We want them to understand how children have appropriate age behaviors, and sometimes our expectations for our kids are just out of whack, especially during this COVID time. We may have one kiddo at the beginning of COVID, and now we're looking at a different kind of a child. And how do we parent that? I have to develop new parenting skills in the middle of all of this stuff. So it can be incredibly overwhelming. So please reach out, whether it's through a report to child welfare or the child hotline, or it's referring somebody to the COPES resources that have been provided. We have an emotional COPES support line right now for families who maybe it's not a true crisis, but they're having just a lot of emotional downtime now with the COVID experience. The state of Oklahoma Department of Mental Health has also put out a statewide hotline for families or individuals who may be experiencing particular stress with COVID at this time. So there are resources out there. If you don't feel like you're the one that can be burdened with fixing everything for people, we don't want you to be. We want you just to be that connector, to know these things are there, and to help spread that word for yourself, your loved ones, family, neighbors, whomever. So lastly, let's think about some of those resources. As Kim mentioned earlier, there's the National Child Traumatic Stress Network that has wonderful information about COVID specifically. It has other information out there about parenting and child abuse and trauma and how to recover, and the hope and resiliency that goes into that. Obviously, we've got 211 that is a great resource for us locally, keeping up with all kinds of information about where can we get food, who's doing utility assistance. Lots going on right now with renters and mortgages, and what kind of relief are we able to share with families about how they can think about making sure that they're not being evicted or getting bills paid, how to apply for unemployment, those kinds of things. Our Tulsa Health Department is phenomenal, with Dr. Dart out there leading the way, helping us understand what we need to be doing in our community, and also helping about resources for what our families can think about. 0 to 3 is another wonderful website. It's for the younger kiddos. Lots of activities and resources out there. Again, if you have somebody that you know that could benefit from extra information or videos or other kinds of media ability to get information to our families so that they can be successful in their parenting practices. I did see that there is a question about the COPES hotline number. So the COVID emotional support line for the COPES number is the same as our COPES crisis intervention number, and that is 918-744-4800. And I believe that that's something else that is probably going to be posted. I do want to share, although people don't have paper and pen necessarily right at their fingertips, but if you do, the Department of Mental Health's COVID-19 number for those who are outside of Tulsa, or the Tulsa surrounding area, and you want to give a number or a website for them to go to, they can go to ok.gov/ODMHSAS, or they can call 1-877-215-8336. And I'm sure Krista is going to help me with all of that. She's phenomenal at managing all of us and our information. So I just want to leave by saying that I appreciate everyone being on the call and United Way taking this on for us as we're all concerned. And Mara is saying, you know, those kiddos and families that we are seeing right now are kind of the most at risk in terms of some of the severity things we're seeing, because they're coming through the emergency rooms, they're coming through ways where they've gotten out on their own to try to get help and reach out. So we want to be sure that, you know, anybody in our communities, whether you're a postal worker, whether you're a food delivery person, whether you're someone like me who does still go to the grocery store, we can do some of our own things in our community too. We are not helpless to this. It may take us a moment to kind of pause and think about a little bit and how we can intervene in a really proactive, kind of resourceful way. So just want to encourage everybody to think about that. I know we're all stressed and adapting to things too, But I think together as a community, Tulsa is so strong, we can definitely help those families and children who need our support. So thank you.
Thank you, Christine. As I was listening to all of the panelists, I was furiously jotting down some notes, as I'm sure some of you were as well. But when you came across the tip, Christine, for how parents can cope through this, you mentioned take a nap if you need to during the middle of the day. And I will have to say, I certainly took advantage of that. You really have to do what you need to get through and make sure that you take care of yourself so that you're able to take care of your children. And Christine, thank you so much for sharing those resources, and we'll make sure we get that emailed out to all of our participants on this call. I would like to one more time give out the COPES COVID emotional support line number. That has been a huge resource for people during this time to be able to call and ask for help. As Christine mentioned, asking for help is so important, and that is the first step to really getting the assistance and help you need to making sure that everyone stays safe and healthy. And that COPES COVID emotional support line number is 918-744-4800, 918-744-4800. Before we close, we're gonna answer some of the questions that have been submitted. And if I check my phone, I'm gonna go ahead and throw out the first question that was submitted, and that is, if you're in domestic danger, we've all seen the quote unquote, if you're in domestic danger, contact me about my soap or whatever. If you need immediate help, put a shipping address Facebook post. I think I'm butchering this, but I hope you understand my gist. Would the panelists recommend that as a general strategy for those interested in providing support during this time? If not, what is the best way for those who are social distancing to provide support to our community? Let's see, Christine or Kim, would you want to address that question?
Sure. I think, I don't know, let me look at my view options here. I don't know if you can hear me or not. I think I'm okay.
Yes, I can hear you, Christine.
Okay. So I think the question is, while you're social distancing and staying home, how can you be a help to the community? If that is the question, I think we all have our bubbles of influence. We have our spheres of connections, those kinds of things. And I would really, encourage everybody to use those and to promote awareness in those conversations. Again, I think it's one of those things that we kind of just assume everybody else takes care of something if it comes up. But if you have your social systems, church groups, book clubs, those kinds of things, that it be a conversation at some point in time. I know, being in this field as long as I have, there are plenty of families through my own social situations that I have worked with over time, and we've all needed help. We've all needed to know when to ask for help, or have somebody tap us on the shoulder and say, you're getting a little crispy, how about a little bit of support? So definitely, and not waiting for that to have to be brought forward, but be the person to bring that up and to ask if everybody's okay, or encourage other people to report or reach out. I really think that it can be wonderful if we can do it on a more preventative time versus having to just be reactive. I don't know if Kim or Mara would have anything to add to that.
I would just say that we know part of the technique of forensic interviewing is building rapport. So to post something broadly, like you can contact me, is a wonderful sentiment, but kids are more likely to report to somebody that they have a rapport with. So I'd be especially cognizant of those kids in your life that you're really close with. We think about teachers, family members, these are people that are around our kids every day and hear from them. They trust us. So as a trusted adult for those little guys, and make sure that your eyes and ears are open.
It looks like Kim's concurring with what Christina and Mara has suggested. Another question we received, do you have bilingual, bicultural personnel to help parents who speak another language to have access to the support they need under these special circumstances?
Yes, I can say at Family and Children's Services, we have multiple methods to do that. One, we really try to get a lot of information out into a lot of these other communities through a lot of the connections and partnerships that we're a part of. So we also partner with several translation services here in the community and across the state, the YWCA being one of those. And we also have a language line, and we can access various languages within minutes to be able to provide either over the telephone, which we've been doing a lot lately over telephone and video, as well as some interpreters we're doing some face-to-face before that. So lots of opportunity there, as well as when we can hire bilingual staff, we try to do so. And I know Parent-Child Center and can have their unique ways as well. I think our concern, and one thing that we did have come up during this time, was recognizing the fact that some of our undocumented families were particularly anxious about even going to the grocery store, not being entirely maybe sure about what some of the community rules were in terms of staying safe and sheltering in place. And so that's come up a lot with a lot of our work staff, helping to be the one to inform them about what the mayor is saying, what the police are thinking, and how to understand a lot of that, because they don't want to raise a lot of awareness of themselves if they feel that they could be at risk because of their status right now. So we've spent a lot of time working with these families to try to reassure them and get them the resources they need so that they're not feeling even more at risk during this time. So I appreciate the question.
Kim, do you want an opportunity to answer that question as well?
Sure. I mean, second everything that Christine said. At Parent-Child Center, we do have a couple of bilingual Spanish-speaking therapists that are able to provide parenting groups, individual family sessions, and I think we're also seeing some of those same concerns with families being, especially some of our Spanish-speaking families, being concerned about being out in public and the risks that it has for them. So we want to be very sensitive to those concerns. And
here's another question that's similar along the lines of bilingual and bicultural, but a little bit different. How do agencies reach immigrant or undocumented families when there are language, cultural, and possibly legal obstacles? Christine?
I think a lot of that, one, we try to get a lot of information translated, and that is a never-ending opportunity for us. So, and when I say translated, you know, Spanish is the primary language of, other than English, that we serve, but we certainly have had a multitude of other languages that we work with. And so it tends to be a more organic kind of word of mouth situation. We definitely try to reach out to other cultural resources in terms of church groups, faith-based groups, anybody else who's promoting any other kind of literature, magazines, Networking Catholic Charities is a wonderful resource and partner, as well as several others where we really try to outreach to these families. We've had many, many Hmong families, lots of different language barriers. And so we try to translate as much as we can to have the documents in the family's language. If we can't translate everything, we look for resources. For example, NCTSN has a lot of their resources translated into Spanish, some into Chinese, some into just a couple of other different languages out there. So we look for those to try to see what we can get to our families. But it definitely is, again, like I said, an ongoing opportunity for us to keep looking at how can we ensure that our messaging can go out in multiple ways.
Laura, do you want an opportunity to speak to that question as well?
So most of our referrals come through law enforcement and DHS. You can't just kind of walk into CAN for services. But we also, of course, have staff on our team that can work with these populations. It's something that's important to us. And we have a Spanish-speaking forensic interviewer. We also have, TPD has a detective. So it's nice that we're able to kind of respond to those families and meet them where they are. We know that in stressful situations, you'd want to rely more so on your native tongue. So it's nice to be able, under that duress, to be able to communicate in your own language.
Mara, since you're the last to speak, this question goes to you as well, so don't unmute. You mentioned that you have a big uptick, or you've seen a big uptick in domestic violence cases. Are there data points to back that up at this time, or is it mostly anecdotal?
I would say mostly anecdotal. We just kind of know what we typically see at the center, and we're seeing a lot more of those. I know the criminal courts are also seeing those. My husband happens to work in the criminal courts, and he has relayed to me that they're seeing perhaps even double what they would normally see, and definitely more significant or more severe abuse that these kids have been exposed to.
Another question, do there tend to be common ways that perhaps we as a community or as community members accidentally cause harm or that aren't helpful while well-intentioned in encountering these types of situations? I'm not sure what the what type of situation the question is referring to, but can we accidentally do more harm than good?
I'll just throw in a quick 2 cents on that. One thing that is hard for us, if a child has already been, sort of quote unquote interviewed, it's difficult, and it actually goes against our protocol to bring them in for an additional interview. We really want to reduce the trauma that these kids and their families experience by having to tell that story over and over again. So if a child discloses to you, really, you just need to know who, when, and very, very, very basic details. Don't get into the whole process of tell me more about that. And also, you don't want to say anything negative about the abuser, particularly when it comes to sexual abuse. We know that these kids love and trust these people that have done this to them. And even though someone might have hurt them, they still really care about that person, especially if it's a parent. So to say you never have to go back there again, or what a horrible person, we're going to get him, that's not the kind of feedback that child needs. Just believe them, tell them you believe them, and support them.
I would definitely want to echo what Mara says. I think in terms of, if you see somebody out in public, I tend to think of times when we can react very judgmentally to families who are already in a precarious situation. And then I often worry that when that child and family are out in the car going home or later home, what the repercussion of that is. So if we are shaming a parent in front of their child or something because of the lack of parenting or whatever was going on, then that goes to really potentially cause that to escalate probably more, or that parent to feel worse about themselves. So I know I have experienced that multiple times in stores myself, where I've wondered, what the heck are these people doing? And had to really dig deep in myself and think, well, wait a minute, you know, how can I try to turn this around and see if I can say or do something that might intervene a different way, even if it's a tiny, small intervention. And then trying to kind of, again, lift people up so that they don't feel so judged or frustrated in those moments, and then take it out on the kids later. And kind of normalizing some kids who are acting horrible, or try to distract them and help the parent a little bit, instead of kind of rolling our eyes and walking away. I think there's moments we can intervene that way. And then definitely, as Maura said, you know, if we are made aware of something, you know, trying to make sure that we are listening more than anything, and then not promising that we can fix everything, but certainly take those necessary steps to ensure that the child is safe, and then report as needed.
We've got 2 more questions I'd like to get to. First, if we are aware of prior abuse connected to a specific adult in the family, and the student came into your care as a result of moving away from the abuse, but the individual suddenly shows up as an in-town contact for the child on school records, what is the appropriate action?
This is Kim. One thing I would do is start by contacting if there was a previously involved DHS caseworker, to get some more information and make them aware of that. Check in with the school if there's still safety concerns involving the child, active safety concerns. Look at getting a protective order in place and making sure the school daycare has copies of those records. And you know, if there's additional safety concerns that are imminent, you can even make another hotline report to DHS.
Kim, this last question's for you. Someone is asking how clients can get a Totes for Hope.
Yeah, that was a program that was a specific fundraising program that we did at Parent Child Center for the children and families involved with our therapy services program. I would encourage, if they have a mental health provider, a case manager, or a DHS caseworker, to check in with their service provider about what resources they may need in particular to help their child, you know, with school supplies, activities, emergency food, or other resources. Also, as Christine shared on the resource page, contacting either by email or phone, 211. They have an amazing catalog of resources and can help connect people.
Christine, Kim, Mara, thank you so much. I'm going to turn it over to Brent, but before I do, thank you all for joining us on this call. We will be emailing you the resources and information that was mentioned on this call, and the Lookout, Reach Out campaign. We're going to be hopefully hitting the airwaves soon with this information. You're seeing the social media posts about it. Please share those if you're able. I'm going to turn this over now to Brent so he can wrap up.
All right. Thank you, Kristen. Great job moderating our conversation today. Again, thank you, Mara Gooten, Child Abuse Network, Kim Parker, Parent Child Center, and Christine Marsh from Family and Children's Services. It will require compassionate, concerned Oklahomans like you to end the issues of abuse and neglect in our community, and not only as mandated reporters of abuse and neglect, but working together to affect change and impact young lives in a positive way. Many of you do that every day through your child welfare organizations like the ones you've heard today, our clergy, educators, medical and law enforcement professionals, neighbors, friends, and relatives. It is all our responsibility to protect and nurture the children in our community. Thank you all for joining us today. We appreciate you signing in. I believe I saw a number of 127 at one point. I think that's just fantastic. I know that there's some who couldn't join us today due to other obligations, and as Krista mentioned in the beginning, that this video recording is available on our website later today or tomorrow. We're here to help, so please reach out if there's anything that we can do for you. And thank you all once again, and that will conclude our webinar. Thank you.